Hello guys, welcome to Hailsoft EdTech. My name is Dr. Ezeadichie Emmanuel and I'll be your instructor for today's course. Directional terms in veterinary anatomy. Now, imagine a scenario whereby you are trying to communicate a lesion or, an issue that you found on an animal's body, and you're trying to communicate it to another vet. And you're telling the vet that the lesion is found on the top of the animal's body. That is not the right way to communicate in veterinary medicine. Because when it comes to veterinary anatomy, they have a standardized anatomical word that they use in describing the location of structures within an animal's body. And in doing so, when they use such standardized anatomical words, it helps another veterinarian across the country or in any part of the world to be able to what? To accurately locate where that lesion is. So directional terms, in essence, they provide a universal language that allows veterinarians worldwide to communicate accurately. That is the whole essence. So when you see the words like cranial, caudal, dorsal, ventral, lateral, medial, do not just cram them. You need to understand the principles why these names were named the way they are, why these standardized anatomical words are used. Because in understanding them, you will be able to what? Accurately locate any organ, any structure in any part of any animal. And I'll be going further to buttress my point, to tell you why directional terms is essential in the veterinary practice. Because a whole lot of vet doctors are out there and they don't really know how important directional terms is. Not just directional terms, even body planes and even body cavity. And we've talked about the body planes, and now we're on the directional terms. Now, directional terms is important because as a veterinarian, it guides you while carrying physical examination on animals. And also, while running diagnostic imaging on animals. These are key to help you identify where abnormalities are. And thirdly, they can be used as anatomical words that are found across the foundation of anatomy. So you see, directional terms are not just ordinary words that just originated from anywhere. These are words that have been invoked, that have been used for a very long time. So when you open your veterinary atlas, your veterinary journal, your article, your textbook, you're going to see these words there. They make up veterinary medicine. And in surgical procedures, a surgeon would not make any incision into an animal without having a good knowledge of his or her directional terms. Imagine now you are to carry out a cesarean section and you're meant to make an incision on the left abdominal flank of this animal. And then you don't know where the abdominal flank is. But with your proper knowledge of directional terms, body planes, body cavity, the body cavity will help you locate where is the abdomen found. The body planes will help you locate which part is the right part to carry out this surgery. You understand? Where will I lay this animal? Is it on the right lateral recumbency or on the left lateral recumbency? Then the directional planes will help you pinpoint the exact location. Is it the lateral medial, the lateral abdominal flank? So your understanding of directional planes is important. Now, when you talk about physical examination, We all know that these animals, they can't talk. They can only just see us. And when they are feeling these pains and they cannot communicate their problems to us, we as veterinarians, we have to examine them physically. So you either examine them from region to region, from the head region, the neck region, the thoracic region, the abdominal region, the pelvic region, and the caudal region. So going region by region is also part of what physical examination. And with your understanding of the directional terms, you will be able to check, am I examining the hind limb, the distal hind limb, or am I examining the proximal hind limb to see if there's a lump on the what? The hip region. You understand? Or am I examining the plantar surface, to see why this dog is not bearing weight on the what? The right what? Hind limb. So your knowledge on directional terms will help you what? Examine animals faster. You will not see, okay, why is he always lying on the floor to scratch his back? You will not check the dorsal region of this dog to see, is there any what injury? Is there any what rashes around that place? So your understanding of directional planes will play a what huge role in your becoming a professional in veterinary what anatomy. Now, let's imagine now a dog is having a nasal discharge. You understand? You will just say there's a nasal discharge, rostral to the eyes. You don't just say nasal discharge is rostral to the eyes. You need to understand why do they use the word rostral to the eyes. Because anything that is going towards the nose or the muzzle, this here is the nose, okay? This is the nose. Let me highlight it for you, okay? This is the nose. And anything going towards this nose like this, okay, is rostral. So, and you know that the nasal discharge will be coming out from the two nostrils. And they are telling you that what? The nasal discharge is rostral to the eyes. This is the eyes. But the nasal discharge is towards the nose and is more rostral to the eyes. So that's why they're telling you is what? Rostral to the eyes. Then they could be telling you that what? A wound is located on the medial aspect of the what? Of the right thigh. So the first thing you're going to do is what? Locate the right thigh. This here is the left thigh and this is the right thigh. And they're telling you that it's on the medial aspect of the right thigh. So they're trying to tell you the wound is around all these regions. As you can see on this image that is circled here, the wound is around this region because medial, when they tell you the word medial, they're trying to tell you what? It is closer to the midline, to the median plane. When they tell you lateral, it means it is farther from the median plane. Okay? And they could also tell you superficial or deep. Now, you could be hearing such words like the laceration is superficial. So they're telling you that the cut that the animal had is just on the surface. So let's say this animal was just passing through a gate and it had a cut around this region. So if a doctor examines it and see, they brought the dog to the hospital, they say, doctor, come and check, oh, my dog is bleeding. So when you now check, you've cleaned the surface of the wound, you now observe that this laceration is just a superficial laceration because it is what? It is located on the surface of the what? The skin. But if it is located deep within the skin, that's far away from the surface of the skin, you use the word deep. Okay? So a mass could be present, or you understand, on the thigh, deep within the thigh. And the only way you can identify that mass is by what? Palpating. So you see, directional terms are used in physical examination to help veterinarians communicate the locations of findings accurately during physical examination. Because if you cannot locate any findings that you have made or that you have observed in the animal's body, you can't locate it properly and accurately, then you see you are having a long problem and you have a long way to go. So this is among the reasons why directional terms is important. Then two, directional terms is important in diagnostic imaging because it allows veterinarians to what? accurately describe the location of an anatomy and of a normal anatomy and abnormalities on imaging studies. Now imagine a scenario whereby this dog was trying to cross the road and then a motorcycle smashed the dog. And then when the dog got up and was trying to walk, but he could no longer what match the forelimb, the left forelimb, the left palmar surface of the forelimb on the floor, and you don't know what happened. So when we now go to run an X-ray, the X-ray was not showing us that what actually happened was that this animal had a dislocation on the what on the radius. He had a dislocation on the radius, the distal radius around this region. So with a good knowledge of what your directional terms, immediately you receive the message that the animal had a dislocation on a fracture on the distal radius. You already know where the fracture occurred and you start making plans on how to immobilize the particular area. So you see, directional terms are important in diagnostic images so that you as a vet can identify where the abnormality is in the body. Be it X-ray, be it CT scan, be it MRI, because most times directional terms are one of the important ways via which we could use a CT scan to detect pregnancies. Because when they put the probe on the abdominal region, you'll be able to be going and be checking. You'll be able to know where the uterus is found and know what you are seeing. So directional terms are very important and you should learn it. Okay. These are among the reasons why it's important. And the first one is what? The first one is they are used for physical examination, while the second one is for what? Diagnostic imaging. And the third one is they are used for surgical procedures because they help surgical team because when you want to run a surgery, you have to be like 2 or 3, you need helping hands. And with a good knowledge of what your directional terms, you could communicate with your team the location where you want to precisely make an incision. And in doing this, you avoid damaging another organ that you were never supposed to damage. So a good knowledge of your directional terms will help you know that when you want to carry out a cesarean section in a dog, okay, or in a goat, you will know that the directional terms will be able to guide you to know where to do your nerve block, your inverted L block, and also to know at which point and how many cm to make an incision on the left abdominal flank so that you can bring out the baby. So you see how important directional terms is. You understand? Very, very important. Then directional terms are also used in anatomical description because when you go to your anatomy textbook, you go to your journals, your articles, you understand, your atlas, you will find these directional terms there. Cranial, caudal, dorsal, ventral, lateral, medial, proximal, distal, they were all used there. And without them, you would not be able to understand the principles of anatomy and how to identify structures and organs effectively. So one of the best things you should learn first is your body planes, and once you're done understanding your body planes, how an imaginary line divide the body into 2 equal halves, then you also go forward to understand your directional terms so that you'll be able to know if a particular structure or a lump or is located around the nasal region of a dog. You say it's rostrally located. If it's on the tail, you say it's caudally located. So you see, most times all these are very important for us to be able to excel in the veterinary practice. And these with these four major importance that I've been able to highlight here, I feel I've been able to pass a good understanding of why the directional terms is key to any veterinarian, because with it, you will be able to what? Identify abnormalities and normal things in the body of an animal faster, be it in the head region, be it in the neck region, in the abdominal region, the thoracic region, or the pelvic region. And from here on our next video, we'll then be going into talking about what the major directional terms that we have in veterinary anatomy, where I will now explain them properly for you, explain how they came about and how it is being used in clinical ward examination. So stay tuned and thank you once again for being a part of this video. See you on our next video. Thank you.